and welcome to my channel. This is Dr. Victoria Gibbons, your board-certified facial plastic surgeon and owner of Gibbons Facial Plastic Surgery in Austin, Texas. Today I am discussing the mole removal procedure and recovery. So stay tuned to find out everything you need to know, and don't forget to hit that subscribe button and like below. Let's get going. Alright, so here we go with the topic of the day, behind the scenes of a mole removal procedure and recovery. How is a mole removal procedure performed? Well, a mole removal is a cosmetic treatment that is performed in the office in less than an hour using only local anesthesia. There are two ways to remove moles. One is a shave excision and two is a direct excision. Let's explore these a little more. A shave excision literally shaves the lesion off at its base using a specialized blade, and it only takes a few minutes to perform. While a direct excision, on the other hand, also removes the lesion, but does so by cutting down into the skin below the skin's surface. This procedure takes a bit more time and requires the use of stitches or sutures. Both of these options are performed in the office under local anesthesia. So how do you choose which procedure to perform for different moles? Well, it depends on the mole itself and its location on your body. A shave excision is considered when the bottom or base of the lesion rests above the level of the dermis. Let's sidebar here for a moment and talk about what this means. The dermis is the inner layer of the two main layers of skin. It contains connective tissue, blood vessels, oil and sweat glands, nerves, and your hair follicles. So if you cut into and past the level of the dermis without properly closing the wound with stitches, you may end up with poor wound healing and an unsatisfactory scar. This is why a shave excision is only performed for lesions at or above the level of the dermis. Now, if the lesion does involve the dermis, then a direct excision is usually necessary for complete removal of the mole. That means physically cutting out the mole and using a set of stitches to close the edges of the remaining skin back together. What about scarring? Well, I always tell my patients, anytime there is a cut to the skin, there is always a risk of a scar. But take, for example, a brush burn or an abrasion. This type of injury cuts the skin by peeling off the top layer of skin, scabbing over, and then typically healing without a noticeable scar. This is similar to what a shave excision is because we are only removing that very top layer of skin. So while there is always a theoretical risk of a scar, it generally heals without any issue. On the other hand, a direct excision will definitely leave a scar, but remember, it's the visibility of the scar that's important, and we try to minimize that. Recovery after a mole removal procedure is pretty simple. Every practice is different, but I use a special type of tape that keeps the area covered during the first week after healing. The tape will be removed in the office, as will any sutures that have been placed. The treated area will remain pink and red for quite a few weeks, sometimes a few months, and then gradually turn to your normal skin color over the course of a year's time, generally in the first few months though. Your final result will be around 1 year post-excision. Using sun protection, including hats, sunscreen, proper skincare, anti-scarring treatments such as creams, gels, microneedling procedures are often very helpful to speed up the healing process. In fact, all my patients that undergo a direct excision are required to have post-excision microneedling or Morpheus 8 sessions for the best outcomes. Now remember how I said hair follicles rest within the dermis? Everyone has seen, and some may actually have, a hairy mole. The hair growing through these moles is often dark, coarse, and growing rapidly, and it's common for hairy moles to involve the dermis, meaning that in many cases, a hairy mole can only fully be removed via a direct excision. You can learn more about hairy moles in my other videos on this channel. Now, in cases where a shave excision is performed and a mole grows back, which can definitely happen, although it's rare, the two options are to reattempt a shave excision or perform a direct excision. The proper treatment plan will depend on many things, including the type and size of mole, as well as its location on your body. And that's why it's so important to have a full consultation and assessment with a board-certified surgeon with significant experience in mole removal. And finally, if a lesion or mole appears suspicious in nature or has characteristics that are worrisome for a malignancy or cancer, a biopsy is often performed and sent prior to full removal because it's important to know what type of mole or lesion we are dealing with before we actually remove it. Now, if you found this helpful, I encourage you to watch my other videos on why moles occur and if you are a candidate for mole removal. As always, we know that personal transformation is one of life's most meaningful journeys, and Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those of you who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.